BeatO was really born from a personal pain point when, unfortunately, my co-founder Yash and I, both while we were still in our early 30s, were diagnosed with type 2 diabetes. And we wanted to do something that would help ourselves and perhaps in the process build out tools that could help positively impact millions of Indians and perhaps several more folks around the world.
This is a question for both of you. I mean, it was interesting to see Kushal's chart there on how the sector's kind of grown, but you guys are close to the ground. I mean, 2020, 2021, we've seen this global pandemic and first part of the year was shut down, second part great adoption. But I want to understand from you folks as to how have you seen 2021 being different from 2020, right? And how has it been different from the previous years, and what is the real change that you've seen, whether it's on the demand side or on the supply side, purely to understand your perspective of how the year has been different from the last few years?
COVID helped accelerate, the patient adoption. So before, where perhaps there was a bit of a lacking trust in online services as far as health was concerned, I think it helped us bridge that gap. And many more people got a chance to actually experience digital health who were otherwise, just shoving us away. So, but once they started, testing these digital health services, they realized that these could actually make a positive impact, both in their health as well as in the convenience that these services brought. And I think that's what, of course, on the patient adoption side has helped keep that stickiness intact. I think two more, perhaps for me, when I look at, of course, ourselves and what's happening around the ecosystem, a couple of more positive developments took place. I would say, also adoption, and I would even add familiarization by the healthcare providers, and especially when we're looking at doctors, that took place quite rapidly. So it's no longer the case that, technology, so, doctors feel a lot averse to technologies now. I think they want to, doctors who are relatively older in age, they want to experience technology, and many of them have started using it a lot more than before. And second, I think other stakeholders in the ecosystem also started to now realize the importance of digital health, as I think in Kushal's presentation, I think the starting slide said, hey, we are bringing digital health into the mainstream. Whether this was the pharma companies and health insurance companies, what earlier used to be the case of us wanting to push ourselves and piggyback on them. Now, for the first time, sort of tables turned and they started coming to us. So I think those were, in my view, in addition to what Gaurav said, positive developments certainly coming out of the COVID situation. Of course, when we jog our memory back about a year or so, those were difficult times, as Gaurav said, supply chain issues. I was, in fact, running, calling up Gaurav and a lot of other folks trying to understand what they're doing so we could implement those changes. But I think once those SOPs, etc., started to get built up, I think it smoothened the process a lot for us. And this uplift in terms of both demand as well as partners allowed us to quickly scale to perhaps what we weren't able to do a few years before COVID. Outpatient care is largely all out of pocket, and the wallet size is fairly limited in its size, right? So I think all of us, or most players, would want to definitely try and extract as much as possibly can from that limited wallet size that is there. Having said that, when it comes to healthcare, I increasingly have started to believe that it is a role playing in terms of expertise that different aspects of health need to be able to carry in terms of the product and the solution, and it's not very easily transferable either. A non-tech way, if you have a normal cold and cough, you'll perhaps go to a GP, but you have a more complex situation, you'll perhaps go to a more expert in terms of the speciality that you need to address. So in the same way, I think as far as healthcare is concerned and the trust building is concerned, there will emerge expert solution, which will have to be, of course, and I'm a little biased, of course, from the space I come, will have to be vertically integrated, but there is obviously going to be horizontal players and ecosystem builders like what 1MG and Pharmacy and others are doing. But there is a very solid role playing that experts and vertically integrated players like us will also have to contribute in terms of ensuring that when long-term engagement with patients or members is concerned, it can be dealt with an expert hand-holding them over a long period of time.
But I always felt that this whole preventive space is, on paper so large. I mean, just the fact that awareness is not there, and hopefully, COVID is just kind of triggered that bit of antenna in everybody else to be a little bit more aware of what our health condition is. Do you see progress there, in the sense that we will see more companies that are focused more on preventive than on saying, I go, once something has gone wrong, I'll help you get something, surgery or whatever all of that is, right? But really, do you see an opportunity for platforms to say, okay, here is something that you might want to help you, whether it's devices, whether it is, monitoring, whether it's everything else that can be put together, right, as a service that help people manage their, health even before they get into a situation of requiring any intervention?
So I think, Ranjit, if people didn't feel the importance of preventive health before, I think COVID just showed us how important it is. Unfortunately, people with chronic conditions like diabetes, hypertension, etc., were unfortunately at the brunt of mortality and other aspects. So I think overall people have started to realize the importance of being relatively more proactive. I would say, use the word relatively, because we have, as humans, have a tendency to go back to the old state. So people are definitely relatively more health conscious. Of course, how that pans out over a period of time is something that, of course, we will also want to keep a close eye on. But broadly, people wanting to monitor, people wanting to, get various aspects of their health in order, so that certain complications don't arrive in the future. I think that realization and that understanding has definitely come in more than what it was before. So, and I can just point it out with some of the metrics we have. For us, simple things like the reading frequency. So frequency of people monitoring their sugar levels has gone up. Increasingly over the last year or so, we've seen the growth being led through people coming from smaller towns, so tier 2, tier 3 cities, as well as the fact that very interestingly, about 55% of our members who are coming in and having starting to engage with nutritionists and dietitians, etc., have never had a formal advice being given to them from a dietitian or nutritionist before. So I think all these are very interesting signs for us to start building hypotheses for the future, that there has been a change in terms of how people think about their own health, and which is positive, in terms of how eventually some of the platforms, the way we are trying to build services and products for the future, can get more adoption than perhaps it was a year and a half or so back. Also such a massive white spot, no? I mean, people with diabetes actually don't find insurance very easily, or it's very expensive. And with platforms like what we're trying to do and some of the others, now we are able to actually help help people improve their condition fairly quickly, and that's when they can actually enter into an insurance product or get an insurance program as well. So I think that's true. Of course, we will have to perhaps also see a greater penetration of payer systems come in. But having said that, I think these compliance-based incentives can also be built, and what we are trying to do, and perhaps you also do, Gaurav, can be built while payer comes in. There are other means and ways also to be able to incentivize members to be able to start being more proactive about their health. And this is something we always are continuing to do, because we don't have the luxury of a payer system that the US has. So we have to be entrepreneurial about it and figure out ways and means to be able to simulate that in a non-payer environment.
Chronic management, and India basically carries the disease burden of the world, right? Whether it's diabetes, oncology. I mean, we had a million cancer patients. You take anything. I mean, we're fairly large in terms of the depth. And how do you see this? And help us understand a little bit on, how do you look at this, because you're able to track the life cycle, right? Are people interested in outcomes? I mean, because that's not at all tracked in India, for example. And it's one of the questions that came up on the panel, right? As to, does these things help you look at outcomes? And studying that, does that make a difference and help overall cost of healthcare delivery going forward, right?
No, I think as Gaurav pointed out, I mean, we barely just scratched the surface, and there's so much more to do. And given chronic conditions, the sheer volume of folks, Ranjit, who are impacted by it. Makes it clear that, the way to be able to reach out to them is going to be through digital tools. Otherwise, it's not going to be cost effective in any sense of the word. So when we look at, how perhaps an individual can be brought onto the ecosystem or through a digital platform as far as the chronic disease management like diabetes, etc. is concerned, I believe having definitely a tangible hook allows, like, for example, we have the connected starter kit, etc., allows us to be able to penetrate fast at a reasonable cost of acquisition, land up into a household where there is a condition like diabetes. And we're seeing, like I said, a lot of the growth come in, especially from the non-metros, where unfortunately, as Gaurav pointed out, the access as well as the infrastructure is largely missing. And once they start experiencing, digital health, it also becomes, so it's like, we didn't have too many desktops and we suddenly started having mobile phones. And I think perhaps for, the segment of population which we're talking about in terms of people beyond metros, people with, perhaps not as much access because of the economic propensity that doesn't allow that. These people are going to perhaps have 80% digital interaction on health and perhaps 20% physical interaction, as opposed to what might happen otherwise, what people in the metros are used to. I believe that, once you start getting them to taste or get the flavor of digital health, for example, when people start monitoring, they start to and then they get, real-time advice, for example, on the BeatO ecosystem. They understand the why behind their data. They get contextual education about what next they should do to be able to better improve the health condition. And once they start, seeing tangible benefits in terms of, hey, I took this reading, I got this feedback, and when I implemented this, it had this positive impact on my next day's blood sugar reading. That's what actually creates this virtuous cycle of management, and then eventually helping us to be able to also create this virtual cycle of consumption and of course monetization on the platform. So if I look at it, of course, very early days for us, we are perhaps on day zero, and still I think all of us, but having said that, I think the next wave of growth definitely will be the fact that we need people to start experiencing, more people to start experiencing digital health, because as soon as they do, and these are people who haven't otherwise had great access, they realize the benefit very quickly, and now the results are all tangible. It's not like, I went to a doctor, he prescribed me some medication, and I came back and just started popping pills, but never measured myself or got any feedback. Now you're doing it real time, you're keeping progress of, what your outcomes are in terms of evolution of the condition. And that actually motivates you more than you coming back and popping pills and then after a while, just dropping off from the medication itself. So I think that whole, way of perhaps people to experience health, is what will be the catalyst for greater adoption in the near future.
How I wish I could keep this conversation going. One thing is very clear. Last year, we saw a bunch of unicorns, the year of the unicorns as far as India is concerned, right? But one thing is very clear to me. I think digital health is kind of put a stake in the ground last year. And it's very, very clear, given the challenges that we see and the opportunities the tech systems can build for that, this year and the next few years, we will see a lot more that's coming up from the digital health side. Now, really, thank you guys for, having this conversation with me, and I wish you all the best.